Welcome to this Ask the Vet virtual event with Dr. Greer, Revival's Director of Veterinary Services. We are so excited to have Dr. Greer joining us here today. The first question we have comes from Ray. Ray asks, I breed show quality Yorkies. Many of my females are going 1.5 to 2 years between cycles. I feed top quality puppy food, fresh fruits and veggies. In between supplements, Daily Care Plus, and Be Strong. I ordered PG 600, but after reading online comments, I'm afraid to use it on my females. Most people say you have unproductive heat cycles. What else can I do to have more regular cycles? I'd be pleased with even 1 a year. What's your answer to that?
Sure. And that's a great question. One we get a lot. The first thing I look at is nutrition. So it sounds like you're aware of that particular need. But I usually start with a diet, the primary diet that the dog is eating. And I understand you said it's high quality, but you weren't specific about which diet it is. Part of the problem with a lot of high quality diets is the macronutrients, such as protein, carbohydrates, and fat, are easy to assess based on the label. But the micronutrients are much more difficult. And although you're giving the Be Strong and the in-between and some of the other products, you may not be meeting all of her nutritional needs. So the 2 recommendations that we make on diet are going to either be Royal Canin or Purina. The Purina diet I recommend is an all-stage. It's Purina Sport 30/20. I know a few people are concerned about their dogs getting a little chubby on that, and I actually don't mind if dogs are just a wee bit overweight, but certainly not fat when we are trying to get them to come into heat or become pregnant. Royal Canin makes a huge number of diets, and they actually make a specific diet for pregnancy. It's called HT42D. HT42D is intended to be fed from the start of the heat cycle to the 42nd day. But if you have bitches that you're expecting to come into heat and they're not cycling, I would go ahead and start that. Now, it is not the world's most palatable diet. So if you have small breed dogs that are kind of fussy eaters, it might be a little difficult to get them to eat it exclusively, so you may need to top dress it with something like the Royal Canin starter mousse just to make it a little bit more flavorful. I personally feed both the Purina and the HT42D diet, as well as the other Royal Canin diets. So this comes from personal experience as well as professional experience. The problem with some of the other diets are they may not contain the micronutrients, and there's no way for you to assess that on the label. The other problem is that we've seen coming to market in the last couple of years, a lot of the diets that are potato, pea, and bean and legume based. And the pea, bean, and legume based diets tend to be high in phytoestrogens. Those phytoestrogens are plant-based estrogens, which may change the bitch's heat cycle. It may also change the fertility of the male dog. So if you look at the HT42D label, it does say it has soy in it, but they chelate the soy so that the estrogens are removed. So the soy in the diet is not equal to other soy. I would suggest you call the 800 number on the package that of the food that you're purchasing, talk to the nutritionist, see if they have a nutritionist on staff, see if it's a veterinary nutritionist. And the World Small Animal Veterinary Association has an awesome website with a page on it specific to diets. So you can go on there, pull up the list of the questions that you should ask the company that you're feeding food from, call them up, talk to them, call up Royal Canin, call up Purina, talk to their nutritionists and the people in their phone team, and get an idea of what you've got going on. So the first thing I would do is change diet. I would change to Purina 30/20 or Royal Canin HT42D. Then I would certainly continue the supplements that you're on because I think they're appropriate. And then the drug that we use, if we've eliminated all those other things, we don't have them on a phytoestrogen, we don't have them on anything weird. I think fresh fruits and vegetables are great. I like to feed those to my dogs too. As long as you're avoiding grapes, raisins, and because of course those are toxic to the kidneys, and onions and garlic, you want to avoid those. But then I really look hard at a medication called cabergoline. It's hard to get cabergoline compounded down to a small enough size for a small breed dog. The tablet size that we usually use, we can quarter for dogs the size of golden retrievers and Labradors. And we've had good success with bringing bitches into heat with that, but they have to be at least 6 months out from their last heat cycle. They have to have a progesterone level showing that it's less than 1, and they have to be on appropriate nutrition, or it's not going to be successful for you. And then you're just spending money on medication that's going to lead to further frustration. So that's my summary on how to manage that particular situation. Kind of a long answer, but there you go. I don't use PG 600.
Our next question comes from Tina. Tina asks, what causes a little red blood in my cat's stool? Repeated stool exams are negative. Changing food doesn't help. And I give them ProPlan Fortiflora probiotic. I'm feeding instant kitten dry and canned.
Another great question. I think if you've checked for parasites, repeating that test is going to do nothing but run up a veterinary bill. And I'm a huge fan of fecal assessments, so don't get me wrong. I think they're important. If your veterinarian is doing them in-house, you may ask to see if they can send them out. And what you didn't mention is whether there's associated diarrhea with it. If there is diarrhea going along with it, you probably want to check for Trichomonas and a few other parasites that can be picked up on some of the fecal panels that are done at the reference labs. Your veterinarian is not likely to be able to check for Tritrich and some of the other diseases that cause diarrhea. If you're seeing hard stools, that's usually the cause for blood, is that the stool is so firm that as it passes through the rectum, it causes some microbleeding. So it's not anything terribly serious, but it is certainly enough to get your attention. Nobody likes to see blood in the stool. That always worries people. So you may need to add something to the food to help soften the stool. That can be something like a fiber, like Metamucil. You can add something like canned pumpkin or baby squash. You know, the little jars of baby food squash can be used. Anything that helps to soften the stool so that the cat's not pushing quite so hard. That's usually the reason for that bleeding, is the amount of pressure and the amount of pressure coming through this there as the stool's coming out, and the stretch of the rectum. So there's a little bit of a bleed that happens. Not serious, but enough to get your attention.
Okay, thank you very much. Great question. Great answer. Okay, our next question comes from Marion. She wants to know, my female had bad mastitis during her first litter. What can I do to prevent this from reoccurring if I want to breed her again?
Sure, and you should be able to breed her again. She should not be at the same risk of mastitis. I mean, it shouldn't increase her risk. She should be at the same risk as any other dog. The two things that we recommend are starting probiotics prior to the time that she whelps. That helps to establish the right bacteria in her environment and that of the puppies. Sometimes the mastitis comes from bacteria that comes up the duct. Sometimes it's from trauma from the puppies nursing as they get teeth and they start to kind of bite into the gland. That can introduce bacteria. So number one, the probiotics. And number two, we recommend that about 3 to 5 days prior to whelping that we give our girls a good solid bath with chlorhexidine shampoo. We carry one at the Revival catalog that does a super job of keeping them clean. That chlorhexidine is antibacterial. So you're going to clean her up, you're going to get rid of the surface bacteria and get the numbers down to what's more reasonable. Usually the bacteria that causes mastitis is a staph, a strep, or an E. coli that comes from the dog's own body. It's just somehow the bacteria got up the duct or into the gland from those little puppy bites. If you've ever had those puppies bite your finger, you know that is not comfortable. So simply bathing her, and you want to do it a couple of days before she whelps so that number one, she's dry. You don't want her going into labor wet and chilling the puppies. And number two, you want to give a chance for some of the sebum and the milk on the mammary gland to repopulate and get back in there so that the puppies can smell and taste the mammary gland when they are ready to start nursing. So bathe her 3 to 5 days ahead with chlorhexidine and start her on a probiotic.
Okay, thank you very much. Our next question comes from Kay. Kay is asking, what can we do or can we give to our girls to bring them into season? As a 40-year plus breeder and exhibitor, we have had girls cycle every 14 to 18 months.
Mm-hmm. Right. And it goes back pretty much to the same question of before is, what are you feeding? What are the supplements you're on? And then the other questions are going to be other environmental questions. What kind of lighting are the girls in? Are they in a lower level of a home or a kennel where there's not much ambient light? Is it seasonal? We know dogs need probably 14 hours a day of some kind of broad spectrum lighting to bring them into heat. That's why we see girls cycling in the spring and the fall. Starting in January, as soon as the days start to get longer, like January 1st, January 2nd, our practice blows up because all the girls in the county are coming into heat. So we start to see that as soon as daylight starts to change. So you can do full spectrum lighting. You can certainly buy new light bulbs, the new LED lighting that is available for fixtures in the ceiling, improve the lighting quite a bit. The LED lighting is so much better than what we've had in the past with the energy saving kind of lights that people were using from the 70s to around 2010. people were using really energy efficient lighting, which limited the amount of daylight type of light that dogs got. So we see now full spectrum light bulbs, we see LED lighting. You can improve your fixtures, light fixtures, or you can just put them outside if the weather allows for the girls to get more ambient light when they're outside. So nutrition, supplements, lighting, environment, exercise, making sure they're neither too heavy nor too thin. You want to have them at ideal body conditions, so feed appropriately. And then again, if you're still not seeing evidence of a heat cycle, do a progesterone level. Sometimes you'll find the progesterone is high and you actually missed a heat cycle. We see a fair number of these coming to the practice is they think that they haven't come into heat. We do a progesterone with the expectation that we're going to put them on cabergoline, and then we find out that their progesterone is 15. So that means sometime in the last 63 days, she pulled off a heat cycle. You didn't notice it. She cycled without you knowing, and now you're going to have to wait till the next 6-month period for her to come back into heat. So be really attentive. Check your girls every day with a Kleenex if you don't have a male in the kennel that can alert you. And of course, the boys are usually more than happy to tell you, there's a girl in heat. So pay attention to your male dogs because they're going to be a great tool for you as far as monitoring them. If you don't have a male, maybe you get one. Maybe you put a girl in that's been in heat recently or is coming into heat so that she can bring the other dogs in, because we do know that convent syndrome or dormitory syndrome happens in dogs as well as in people, where one bitch in the kennel can bring the other bitches into heat. So those would be my suggestions.
The next question has to do with retriever training. How long can you continue training your retriever for field competition after it has been bred? Alyssa is wondering that.
Yeah, good question. I like to give the bitch the week off that she's bred. I don't want her out running around right after the breeding. I want to have her kind of hanging back, relaxing a little bit. I don't want her out in the water. I want her getting pregnant. I want her kind of hanging out and getting pregnant. I want to make sure that she's on great nutrition. So the Purina Sport 30/20 would be great. And I think training probably from the 2nd week of pregnancy till about the 5th week of pregnancy is reasonable. I am very careful not to overheat the dogs. And I know that sounds kind of crazy in the wintertime, but even in winter, you can get some heavy cover and some of these girls can get overheated. So body core temperature should not go up. It's the same thing as they put those signs on the hot tubs that say pregnant women should not use the hot tub because it raises your core body temperature and that can affect fetal development. So don't let her overheat. And I'm really careful to let them swim when their cervix is likely to be open. So number one, that's near the time that they're in heat. And number two, it's near the time that they're due to whelp. I don't like my pregnant dogs, heavily pregnant dogs, like from the 5th or 6th week to the time that they whelp, out running hard, because number one, that's a lot of trauma to the puppies bouncing around out in the field. And number two, if they're swimming, I always fear that these dogs' body composition is going to change enough. They're not going to have the body fat that they did proportionally. And with that increasing belly, they're going to sink like a rock. So I don't want you out there flailing in the pond, pulling your pregnant dog back out of the water when she goes glug, 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 glug. Also, toward whelping, the cervix is going to start to relax and open, and there are very few times that the ponds are real clean. So you're running the risk that when she's swimming in pond water, lake water, that kind of water, that she's going to introduce bacteria up into the uterus and cause a septic pregnancy. So if she is swimming, maybe a chlorinated pool where you can really control the situation. So it'll depend a little bit on what your circumstances are, but usually from week 5 to week 9, I like them resting and putting on weight. 2/3 of the puppy's growth is in the last 1/3 of the pregnancy. So she may not look real pregnant at 5 weeks, but by week 6, they start to belly up. And that last 3 weeks is when I want her feet up, relaxing, putting on some weight, getting ready to go. I don't want her out of shape, but I do want her thinking about raising puppies instead of the athletic competitions that her body is gearing up for.
Okay, sounds good. Our next question comes from Julie. Living in the South where bugs and parasites are in heaven. I think they're in heaven here in Iowa as well, I think. But I have used both flea and tick medicines, Bravecto, Advantage Multi, Advantix, Frontline, pretty much all of them at one time or the other. I had started with litters of 9 to 10 consistently and now down to 6 to 2 from the same bloodline. I have also treated my yard and with imidacloprid, I'm not sure how to say that, many times to control grubs and insects. Could you talk about the possible correlation of these insect control products and fertility? My dogs have eaten ProPlan 30/20 pretty much all of these years. And again, that's Julie.
And again, we don't have the full story. We don't know how old the girls are. As females age, just like as males age, their fertility starts to drop off. So if you're breeding bitches that are over age 6, it's typical to see a reduction in fertility by about 33% as they age. So if your males are getting older or your females are getting older, you may have a decrease in fertility. You may need to start replacing your breeding stock. I don't think that there's much of a correlation in fertility with some of those products. There may be with others. I'm very careful. We were just talking about this earlier. I'm very careful with reading labels on what products are labeled for use in breeding dogs and what are not. Some of those flea and tick products you've mentioned are not labeled for that use. The only one of the oral medications, there are 4 oral medications. There's Bravecto, NexGard, Credelio, and Simparica, and now Simparica Trio. Of those 4, only Bravecto is labeled for use in dogs that are being used in a breeding program. A breeding program means a dog that's going to be used for breeding. So if you have a 3-month-old male puppy, I understand he's not pregnant, I understand he's a baby, but if he's going to be in your breeding program and the label says not tested in breeding dogs or not for use in breeding dogs, he's a breeding dog. Don't do it. Frontline is safe. Bravecto is safe. Some of the other products are not. It's really easy to pull up the PDF. If you type in the name of the product and type in PDF and product label, you can bring those product labels up. You don't have to be a veterinarian. You don't have to be a veterinary professional to find that information. So go ahead, Google it and read it. Additionally, in our pharmacy, Lori has put together a list of the flea and tick and heartworm medications that are labeled for use in breeding animals and the ones that are not. So if you're questioning what you should do, you can either give the pharmacy or the PCPs a call, the phone staff a call at Revival. We can help you with that. Additionally, there's a new feature on the website that's called the Flea and Tick Finder. And if you go on that, it starts you through an algorithm of questions when you're starting to look at flea and tick products that will walk you through age that it's appropriate, size it's appropriate, breeding animals that are appropriate, and what the products are meant to do if they're meant to take care of fleas or ticks. So in general, I don't think it's your flea and tick products as a whole that are causing the problem. It may be some specific ones, and it may be some other factors environmentally that are causing your litter sizes to reduce.
Okay. And that flea and tick finder that Dr. Greer mentioned, that is a great resource. It really, you can narrow down exactly what you need. And so that is available at revivalanimal.com. Okay. Our next question, this is kind of a long one, so stick with me. This is from Jeannie. Jeannie is wondering, I have a 5-year-old boxer female that had a litter of 6 puppies 10 months ago. She free whelped with no issues. I bred her on the next heat via live cover with progesterone. On ultrasound, day 29 from ovulation, 2 puppies were seen. Ultrasound a week later saw 1 puppy. Reverse progesterone and C-section done on day 64 from ovulation. The vet said there was a large amount of brown fluid in the uterus, some old gunk and some new. She did not do a culture as she did not feel it was bacterial. The puppy sucked in a lot of this brown fluid and subsequently passed at 4 days old. She never nursed. The female was on clavaceptin for 7 days. My questions, what could have been the cause of this brown fluid? And how do I proceed now? She would like to be able to have the next litter in her next heat cycle. What are her next steps and when?
Sure. And some of this is hindsight, so we can't change it. If I have a situation like that in our practice, number one, I don't let my bitches go to day 64 after ovulation. If they don't go into labor by day 62 or 63, we're in there proactively doing a C-section. Number two, culture might not have been a bad idea. Even if they didn't grow something, it still would have been informative. You can have both aerobic bacteria and anaerobic bacteria. Anaerobic bacteria are the bacteria that live without oxygen. You can also see mycoplasma and ureaplasmas causing those kinds of things. So it very well may have been a septic pregnancy where she had an infection and it just wasn't detected. It also can be that the lining of her uterus wasn't healthy from the previous pregnancy. So there's a lot of things that can cause this. She could have had a herpes virus during the pregnancy. There's many, many causes for loss of fetus and loss of pregnancy that you're describing. At the time I do a C-section, if I'm in there and there's an abnormality with the litter, so if I deliver 10 puppies and all the placentas were great, everything was good, I just do a regular C-section. But if I have a situation where there's 1 or 2 puppies or the puppies have resorbed or something else hasn't gone well with the pregnancy, I'll take a little section of the uterus out where I make my incision to take the puppies out of the uterus. So I can biopsy that, and then I take another section of the uterus where there was a fetus that started to form and failed and became a resorption. So I'm now sending 2 samples of the uterus in, one from a normal site in the uterus that had a placenta that was successful and one that was not successful. There's only one lab in the country I'll send these to, and that's The Ohio State University. Chris Permerandin there is board certified in both reproduction and pathology. He's amazing. So if I do go to the expense and trouble of taking those biopsies, that's the only person that I'll trust to read my samples. So a culture, biopsy, those would be very helpful going forward. You don't know what happened, so it's a little hard in retrospect to know, but they can culture the uterus when she comes into heat by using an endoscope. If your veterinarian can do transcervical inseminations, they can also do a transcervical culture and make sure that her uterus is clean and healthy before you start the pregnancy. Make sure nutritionally she's where she should be. And then, of course, you want to make sure that she isn't exposed to any dogs that may be sick during her pregnancy to pick up herpes or other viruses that can interfere with pregnancy. So those would be my recommendations. I feel bad for you. Losing the only puppy you have in a litter is very disappointing. If the puppy didn't nurse, we would recommend giving it plasma as a colostrum substitute with a tube feeding device and giving that puppy antibiotic supportive care because of the amount of debris that was potentially inhaled in the lungs and this poor puppy getting off to a rough start. So could you have made a difference? Maybe, you'll never know for sure, but going forward, you can be a little bit more nimble. And if your veterinarian is kind of at odds of what to do, step up and say, can we biopsy? Can we save the placenta? Can we find out more information so that going forward, because you know you're looking at her as a breeding dog in your future breeding program, be proactive, talk to your veterinarian before you're in trouble and see if there's anything that they can do to help you make a better decision for your next breeding. It's just really important to do that. And veterinarians, when they're busy and under the gun and they're just trying to take good care of her, they may not be thinking about the future of your breeding program the way you are when you're standing outside the surgery room. So talk to your veterinarians and be proactive. And if they want to talk to me, have them call me. I'm happy to talk to your veterinarian.
Our next question comes from Ashley. Ashley says, I'd love to know if Dr. Greer has any experience with higher gen Savannahs, F1 or F2. They can be very challenging around new people and really afraid. It's hard to find a local vet who actually knows a Savannah's behavior and the challenge even just to vaccinate or an exam. Should they be vaccinated every year, every 3 years? As I've heard, the 3 years is not good for them. And again, that's Ashley is wondering that.
Sure. And again, great questions. I love my cat breeders. For a short while, we were Bengal cat breeders. So I have some experience more with Bengals and more with Highlanders and a few other breeds, ragdolls, than I do with the Savannahs. But a lot of the F1 and F2 generations of the Bengals and the Savannahs are pretty similar. And that's that more restraint is not well accepted by cats. So there's a couple things that you can do. One of them is using Feel-Away, which is a pheromone, which can help reduce the cat's anxiety level. But more significantly, we've had really good success with using gabapentin prior to the appointment. So gabapentin is used in people for nerve pain. It's also a sedative. And you can very, very safely give 100 milligrams of gabapentin to a cat 8 hours before their veterinary appointment and 1 hour before their veterinary appointment. And in our experience, when they come into the practice, the cats are far more mellow, much easier to handle. Now, of course, when they're pregnant, we try to avoid doing that. But during these routine evaluations and exams, it's a wonderful tool. So Feel-Away can be used as a spray, as a wipe. You can use gabapentin with it. There's also Zilkine, which is a nutritional supplement. There's a few things that you can use, but gabapentin at 100 milligrams twice will make a world of difference in the cat's veterinary experience. And then, of course, that means your veterinarian is going to be much happier to see you because the cats can be really difficult. And the more you hold on to a cat, the harder they fight you, and the more likely things are to go awry. So we really try to use minimal restraint. Having things like a cat tree in the exam room can be really helpful for the cat as well, so that the cat's not sitting on a cold, hard exam table. There are practices that are now feline friendly and fear-free. So if you look around for some practices in your area that might support that kind of cat handling, that can be really useful as well. As far as vaccinations go, I vaccinate my breeding cats differently than I vaccinate pet cats that have no other exposure to cats. So if you have a single cat in the household, I think a 3-year vaccination protocol is reasonable. If you have the cats that are in a breeding program and you've got males that are being brought in and out, or you're sending females to male cats for breeding, you're going to have some exposure to diseases that you may not otherwise. So you want to have things like FIP checked for. You want to make sure that you're minimizing any chance of tritrichomonas coming into the cattery, which is a really nasty parasite, very, very difficult to get rid of. And then I use the intranasal feline distemper vaccination. There's one with feline distemper, rhino and calisi, and then there's one with feline distemper, rhino calisi, and panleukopenia. And I think those intranasal vaccines are great. You may learn to do those yourself because having your vet do it could be a little tricky. It does require putting nose drops in, but actually cats are better about putting nose drops in than dogs with Bordetella. But I think the intranasal vaccines for both dogs and cats serve a great purpose, and I think they do a much better job of controlling some of the upper respiratory infections that we see, because what happens is you get immunity right at the local level. So where the virus enters the nasal cavity or the oral cavity and then is replicating in those tissues, that's where the antibodies are blocking that viral replication. So it's actually really cool. It's sort of like the oral polio vaccine that people have, or the flu mist vaccine that people were getting for a few years for the flu. So it creates local immunity, and I think they serve a fabulous purpose. You have to be careful that you don't use a modified live panleukopenia if they're going to be around pregnant cats, but I would look seriously at gabapentin and seriously at some intranasal products so that your cats can receive better immunity.
Okay, great. Great question there. Our next question comes from Jennifer. She's asking, what supplements do you recommend for a potential breeding female? My girl is 20 months and I want to do everything to preserve her uterus. Is there something you recommend give her before breeding? And if so, when and what?
Sure. Another great question. So many people wait until the dogs are at least 2 years old to breed them, primarily so that they are mature and so that they can have their health clearances done, something like OFA hips that can't be done until 24 months of age. So a lot of people wait until the dogs are over 2. Unfortunately, a lot of people wait even longer than that. So if they're getting up in that 6 to 8 year old age group and you've never used her in a breeding program, you're running the risk that her fertility is going to start to diminish. So you want to be attentive to the age at which you start breeding her. And as we've talked about before with nutrition, it's important that we have her on a diet that's appropriate for all stage and that's appropriate for dogs that are breeding. People are surprised that Purina, 99 out of 100 dogs shown at Westminster are feeding Purina. People don't always understand that Purina and Royal Canin, even though they're big companies, have really outstanding nutrient profiles. They may look at the ingredient list. They may be influenced by commercials on TV where they talk about ingredients being a significant part. And of course, ingredients are important, but you can manipulate an ingredient list to look like what you want it to look like, and it may not necessarily represent a superior nutritional profile. So I'd look hard at what you're feeding her. And then for supplements, Be Strong is a great supplement. I love the Oxymate product. I like International Canine Semen Bank's CF Plus as well. So there's some really nice products on the market that do a great job in helping with reproduction and keeping those girls having a healthy uterus. And we can't forget about our boys, because we really have to pay attention to their nutrition as well. We tend to overlook the fact that if he's not producing great sperm, you're not going to have any chance of a pregnancy. So breed your boys young, breed your girls young, get a litter out of her when she's 2 or 3 years old. And as far as your boys go, if you have a male dog, and I know that's not part of this question, but if you have a male dog that's important in your breeding program, before he ages, before he has some kind of a terrible accident, get semen frozen on him so that you've got a way to fall back in that dog in a breeding program if something dreadful happens to him. We've seen too many really great dogs, both females and males. Clients have waited too long to breed, and then we end up with problems. So feed them well, read the labels, stick to a diet that we know creates a great nutritional profile for pregnancy and sperm production, and go for it.
Our next question is kind of a follow-up to one that was asked earlier. The person who asked about the repeat mastitis earlier is wondering, you said something have a chlorhexidine shampoo, but which probiotic would you recommend for along with that?
Yeah, and that's a great question. There are 3 probiotics that I recommend. I recommend Doc Roy's GI Symbiotics. I recommend Purina's Fortiflora, and I recommend the Nutramax Proviable. Those are the 3 that we know have the number of colony forming units, CFUs, that we're looking for, and we know are going to give us the right population in the of bacteria in the gut. You have to really pay attention to the fact that these are products meant for dogs and cats, because they don't have the same probiotic needs as humans do. So you cannot substitute human probiotics for the dog and cat ones. So stick to those 3.
Okay, great information there. Okay, our next question comes from Lisa. Lisa says, I recently watched a seminar on breeding and the doctor recommended using the 3rd fraction of semen after inseminating with the 2nd fraction of semen. I've never heard of this and would love your thoughts, please.
Well, there has been some discussion about that prostatic fluid and its ability to support semen during the process of insemination and fertilization in the reproductive tract. If it's healthy prostatic fluid, in other words, if the dog doesn't have benign prostatic hypertrophy or blood in his ejaculate, that's probably helpful. And in fact, there are some people that are mixing one dog's prostatic fluid with another, being sure that they're not using sperm along with it so that they can support that if they don't have healthy prostatic fluid. Most of the time, we don't collect that 3rd fraction. Many times it's just too much volume. So I'll collect the 1st fraction and the 2nd fraction because it's hard to separate 1 from 2. During the period that the dog is actively ejaculating, it can be really difficult to get the sleeve on and get the semen collected so that none of it ends up on the floor. The 3rd fraction, I would use a small amount of it. I would certainly not use all of it. We see some breeds like German Shepherds that will give us literally 40 cc's. That's 1.5 ounces of ejaculate post sperm retraction. That's way too much volume. So I tend not to do that. I also tend to use a lot of semen extenders. So those do have antibiotics and glucose and caffeine and some other cool things in them that they don't even tell us are in there because those are proprietary formulas made by the semen companies. So I tend to use more extender than 3rd fraction, but it depends on the circumstance and it depends on the semen quality.
Our next question comes, is somebody anonymous. I have a 2-year-old dog who chews a toe. He denudes the toe year round, possibly more in the summer allergy season. He's been through a lengthy diet elimination trial and 2 injections of Cytopoint, and nothing really seems to help. Nothing stands out with blood work or x-ray. My vet says she hasn't had much luck with meds for a possible obsessive disorder, more with meds for anxiety. Any advice for that situation?
Yeah, if it's only 1 toe, I would look real hard at that toe, maybe do a biopsy of the skin there. I know you said that they've x-rayed it, so I'm suspecting that they've looked for a nail problem or any kind of arthritis in the toe, but they may want to consider doing a skin biopsy of that area and see if they can determine the problem. The other thing would be to do a cytology and see if there's a yeast infection there. We see a lot of yeast infections in ears and on toes, and that can really be more specifically treated with a ketoconazole type product, either topical or oral. So I'd want to just get a little bit more information. Cytopoint's an expensive drug. It works great for allergies, but it's an expensive drug. And if it's not fixing your problem, clearly that's not a solution. The other thing would be to see if your veterinarian does any kind of laser therapy. Sometimes laser therapy can help with those things healing as well. So there are drugs that can be used. Your veterinarian's right. Some of the same drugs that we use for anxiety can be used for those obsessive disorders. But 1 toe tells me that this is not just an obsessive disorder. There's something very specific that the dog is trying to tell you about that toe. So I'd look a little harder.
Okay. Our next question comes from Mindy. My 12-month-old male did not react when I had 2 girls in standing heat. Should I be concerned?
Oh, you're lucky. Give him time. The next time those girls come into heat, he won't miss that chance again. He probably was either told no by you or told no by one of the dogs so many times that he finally just said, okay, I won't look again. Sometimes they're a little bit intimidated by the females. Before they're in standing heat, they may be intimidating. And then when they are in standing heat, he may have not realized that the rules had changed. So give them time, another heat cycle, and typically they're going to learn that that heat cycle is pretty interesting. And be very careful if you're using him as a stud dog not to tell him no. He needs to be encouraged. He needs to be touched. He needs to be accustomed to the kind of activity that it's going to require to get a breeding. So don't shut him down because he's not going to know the difference between an on switch and an off switch. Let him figure it out and let him play, but don't let him get hurt by one of those bitches.
Okay. Our next question is a cat question. I have a cat returned to my group that is skin and bones and has inconsistent stool. I've tried bland diets as well as using Hill's biome diet with no consistent resolution. She was examined by a vet and has a negative fecal and no obvious organ irregularities. Any suggestions to further try? This is from Barbara.
Yeah, and again, that gets back to that fecal sample. IDEXX has a lot of different fecal profiles. IDEXX is one of the big laboratories, and they have one that is not easily found on their website or on their list of tests. But if you call their veterinary consultation line, it's like the secret feline diarrhea panel. I don't know why it's not better publicized. It's kind of expensive, but you've probably already spent quite a bit of money and you're probably getting pretty frustrated with this cat stool. So I would start with that. Like I mentioned twice earlier, Trichomonas may be a component of this if it came from a household with other cats. And tritric is not going to show up on regular fecals. It's a nasty parasitic disease that we see causing diarrhea in cats. It's not life-threatening, but it sounds like your cat is in pretty skinny condition, so we need to get a handle on it. I think the diet you're feeding is great. So I would get the secret IDEXX panel. If that still doesn't do it, you may want to consider something like Thailand powder to see if you can get things straightened out. But I would not just randomly cast about with medications. I would definitely get a very specific profile done. If that doesn't do it, sometimes an ultrasound to look for thickening of the intestinal tract with a board certified radiologist or specialist. The cat could have some form of inflammatory bowel disease, so I'd be looking at that. And if worse comes to worse, sometimes intestinal biopsies are necessary. But I would get some diagnostics done before I just started throwing more medication at this poor little kitty.
Our next question, I think, is something that a lot of people have a question on. Cindy is wondering, do you breed on each heat cycle or skip a cycle?
Oh, yeah, that is a great question. We used to say skip a heat cycle. We used to say breed and skip, breed and skip, breed and skip. And now we're not saying that anymore. Most of the people who are doing breedings are recommending that if you want to get 3 or 4 litters out of a female, that you breed her back to back. I usually do 2 breedings, skip 1, and then do 2 more if I want to get 4 litters out of a female. I like them to skip 1 because it takes about 8 months for a bitch to nutritionally get back to where she was before the pregnancy. But in general, I think breeding back to back is better. Breed her young, breed her frequently, get the breeding out, done with, let her have the 4 or 5 litters that you want her to have, spay her, and then let her relax and retire. We know fertility drops off by 33% after age 6. And if you wait too long, some of these bitches have uterine aging changes like cystic endometrial hyperplasia that will interfere with the ability to conceive and leads to pyometras. So it's important, if you want to get multiple litters out of her, that you take advantage of that.
Okay, our next question comes from Deborah. She's wondering, can a recently vaccinated dog make other dogs or baby puppies sick by shedding a modified live vaccine?
Yeah, and in general, the answer to that is probably not, but just like with human polio vaccine, they tell you after a person has had a child has had a polio vaccine to be very careful with exposure. So in general, that's not going to be the case. The modified live should be modified, and that means it's modified to the point that it will create immunity, but it's not so infectious that it will cause another infection. Is it possible remotely? Is it likely? Not really. But of course, with any situation, you want to be careful that you don't expose anybody to something that they shouldn't be exposed to. And, they are going to have a little bit of depression of their immune system right after vaccination. In fact, they found the same thing with people getting COVID vaccines, is that shortly after they're vaccinated, sometimes people are getting sick from other viruses. So just be aware that you should be careful, but it's pretty unlikely to be a problem.
Okay, our next question is from Barbara. She's wondering, does Revival have a product that is analogous to ProBoost? This is used when treating a FIP cat, FIP cat, to help boost their immune system.
We are in the process of bringing some new immune modulators onto the market, some of them that are natural.
Diane is wondering, why so much Safeguard and so many days on pre-whelp deworm for dogs? Also, I thought Safeguard only treated for one worm. We usually did Pyrantel also in puppies.
Panacure, Safeguard, fenbendazole, those are all the same product. That will reduce the transmission of roundworms and hookworms through the placenta or through the mammary gland and into the puppies. It actually treats multiple worms. It gets rid of Giardia. It gets rid of one kind of tapeworm, but it also gets rid of roundworms and hookworms as well. So hookworms can be transmitted through the milk, and roundworms can be transmitted through the placenta. So if the female had parasites when she was a puppy, and even if you've eliminated them and you think she's got a negative fecal sample, the stress of pregnancy and lactation will reactivate those parasites that are encysted in her muscles. They'll start to migrate. They'll migrate through the bloodstream and into the placenta. So you'll have puppies born with roundworms. They'll migrate through the milk, and you'll have puppies that develop hookworms when they're very, very young. So no, it doesn't just do one worm. It does one kind of tapeworm, but there are multiple types of tapeworm. It's the roundworms and hookworms we really want to eliminate. And if you do this protocol where you give the safeguard during the last 3 weeks of pregnancy through the first 2 weeks of lactation, which is 5 weeks, not 3 days like the label says, but 5 weeks, it will eliminate that parasite migration. And we've had clients just thrilled with how healthy their puppies are. They don't, at weaning, end up with that little bellyache with the parasites migrating and giving them diarrhea, not feeling good, not eating well, getting kind of puny and kind of sick and yucky. So instead of waiting until they get parasites and then deworming them, you actually head it off at the pass. I don't really like finding parasites in my puppies. I don't think people like to find them. I found them in my washing machine when I don't find that to be real pleasant, and I kind of like parasites. So I try to get ahead of it by using the Panicure, and that works really, really well, particularly if she ever had parasites as a puppy or if you live in the southern states.
And another question from Diane. She's wondering, is VBAC safe? Do you skip a heat if C-section is done previously?
And yes, you can do VBAC. VBAC is vaginal birth after C-section. So as long as the uterus looked healthy and the veterinarian did a nice job of putting the dog back together at C-section, yes, you can certainly have a vaginal delivery after that. Now, the question is, will you need another C-section? Not can she deliver another litter. So 75% of C-sections are due to maternal causes, 25% are fetal causes. A fetal cause is an oversized fetus, a deformed fetus, a dead fetus, a fetus that presented in the wrong position, like it came down out of one uterine horn, and instead of coming out of the cervix, it decided to pop back up into the other uterine horn, so it couldn't be delivered. So only 25% of the time do we see fetal causes, meaning that's why the puppies needed to be born by C-section. That would also be if she had a litter of 1 or 2, and then she goes on to get pregnant the next time with 6 or 8 puppies, she can certainly have a chance to deliver vaginally. If she's a bulldog, if she's a corgi, if she's a Bernese Mountain Dog, if she's a dog that's likely to need another C-section, then you're better off probably just to schedule it instead of trying to do anything fancy. So it is safe, but it will depend on the reason that she needed a C-section in the first place, and carefully questioning the veterinarian at the time of the C-section to try and establish what the cause for the C-section was can be very important information when you're making that decision.
Tammy wants to know, how do you know the difference in the fractions of semen? How would I know when to stop collecting?
Sure. And another great question. There are 3 fractions to semen. Fraction 1 is pre-ejaculate, so that's clear. There's no sperm or very few sperm in the first part. That's where the male is just getting ready. Fraction 2 is the sperm-rich fraction, SRF. That's the cloudy fraction where you can actually see that there is sperm coming into the tube or the sleeve. And fraction 3 is back to prostatic fluid, the clear part, again, no or few sperm in it. So if you're using a clear sleeve or a clear tube, it's easy to see when you go from fraction 1 to fraction 2 to fraction 3. Other than if you want to deliberately collect extra prostatic fluid, like the previous question asked about, I collect fraction 1 and fraction 2, and then I stop collecting and let the male just finish ejaculating onto the floor. You know, take him someplace that the floor is easy to clean up. We have a special floor in our exam room that has a drain in it, so it's easy to wash the floor down and eliminate that. But fraction 2 is the part that has the sperm in it, and it's easy to tell. I do recommend using those soft plastic clear sleeves so that you can see what's going on. If there's blood, if there's urine, if there's no ejaculate that has sperm in it, you can see what's going on. I avoid the ones that have the tubes in them, and please use disposable equipment. Disposable equipment is meant to be disposed of. Use it once, get your sperm out of it, and then throw it away. There's too many problems that go with trying to, save a couple of pennies to save a sleeve when it's really meant to be disposable. So get rid of it so you're not spreading contamination and you're not accidentally breeding one dog to a different dog's semen when you didn't intend for you to have a multiple sire litter. So use disposable equipment, use those nice, clear, soft sleeves. You want to make it really comfortable for the male dog because you want that experience to be good. The tubes can run some risk of, number one, they can kind of clatter on the floor if it's a short dog. And number two, I've seen dogs get their penis all the way down into the tube and get caught. And that's a very, very bad experience for a male dog. So use appropriate equipment, use disposable equipment, and then toss the disposables away, the pipettes, the sleeves, all that stuff is meant to be disposed of. Don't try and cheat. Don't try and disinfect it. You're going to end up killing sperm and missing a breeding over trying to save 15 cents on a sleeve or a pipette. It's not worth it.
Okay. Our next question comes from Cindy. Cindy is wondering if your preliminary OFA are good, what are the expectations for the finals to be the same?
That's another great question. Boy, you guys are good today. 90% of the time, OFA is accurate. If you do the first OFA at about a year of age and then repeat it when the dog is 2 or older, it's about 90%. Now, that of course is dependent on good positioning. So if you had good positioning at a preliminary x-ray and then at the real OFA when the dog was 2 years old or older, the dog was tilted to one side or wasn't well positioned for some other reason, like you didn't get the wings of the ilium on, you didn't get the patellas on, the legs weren't parallel, OFA is very, very clear about what position those dogs need to be in and what they should be able to see on the x-ray. So you can artificially make a good dog look bad if the positioning isn't good. And I am a firm believer that if your veterinarian doesn't take a good OFA x-ray, they shouldn't charge you for it. If you can't get a diagnostic x-ray, then you either need to sedate the dog or find another veterinarian that will help you. I don't sedate most of the dogs that we do OFAs on, but there are a few that will knock us against the wall. You know, they'll pull 3,500 pounds in a weight pulling contest on a Saturday, and then they bring them in on Monday and want us to do an OFA without sedation. It might be a little tricky for my staff because 3,500 pounds is a pretty strong dog. But good positioning, 90% of the time, you should see the same rating at a prelim as you do at the real thing after age 2, unless there's trauma or bad positioning.
Okay. Our next question comes from Lisa. She would like to know your recommended treatment for coccidia for dogs.
I am hands down an Albon user. There are other products on the market that some of them are not labeled for use in the dog. Most of them are not labeled for use in the dog. Some are not even labeled for use in the United States. If you're using an equine product, it's meant to treat a 1,500-pound horse with a tube of it, and trying to dose it down to a 2-pound puppy, you're likely to overdose the puppy, inaccurately dose it, in some way too much, too little. I think Albon is still very effective for almost all coccidia that we're still seeing in the US. What you do have to make sure of is 2 things. One is shake the bottle really well because it tends to settle out. So the recommendation is when you get that new 16-ounce bottle of Albon, that big bottle, that you shake it really well and put it into smaller aliquots so that the medication doesn't settle out and make an uneven distribution of that medication in the bottle. So put it into 2-ounce or 4-ounce bottles and have it more evenly distributed when you go to use it. Number 2, weigh your puppies on a scale. Don't pick up the puppy and say, I think it's about 4 pounds, and then dose at 4 pounds. Dose it according to the actual weight that you get on a scale. If you do those 2 things, you're going to have Albon working very successfully. I give the loading dose on dose 1, and then I'll give another 4 to 6 days of medication. And that should effectively get rid of any coccidia. The other cool thing about Albon is, I learned this a couple of years ago from an infectious disease specialist, and that's that if you use Albon the last 3 days the puppy's at your kennel, and the first 3 days it's in its new home, that will stabilize bacteria in the GI tract. The puppy will have a healthier intestinal tract and be less likely to get parvo. Yes, parvo is a virus. Albon cannot kill viruses, but by stabilizing that during the water change, the food change, the stress of relocating into a new home, those puppies tend to get diarrhea, which set them up for parvo. Albon will stabilize that. So when you send 3 days of Albon home with that new puppy, you're not selling them a puppy that's sick. You're selling them a puppy that's less likely to get parvo because of all those stressful changes that happen during changing households. So use that as a great tool to keep your puppies healthy and keep you from getting those phone calls a week after they get the puppy and telling you that something has gone wrong and that they're sick.
Okay, our next question comes from Ashley. This is kind of a follow-up to the Savannah question earlier. She said, do you also recommend Purina for cats, specifically Savannahs? Mine are pretty picky for only raw, but should I be offering Purina kibble too?
Yeah, and I think Purina and Royal Canin both have great cat diets. I really don't like raw meat diets during pregnancy and lactation. I know a lot of people like to feed them. I know they feel that it's a more natural diet for a cat or a dog, but the bacteria and parasites that we can see transmitted with those raw meat diets can cause some very serious problems with fetal development and with neonates. So I do not recommend a raw meat diet during those periods, even if you do want to use it the rest of the time. We can see salmonella, we can see shigella, we can see campylobacter, we can see all kinds of really nasty bacteria and parasites. We've seen puppies born with neosporum. That is a parasite similar to toxoplasmosis that can cause serious problems in the puppy's neurologic development, and they cannot recover from those parasites. So I avoid those raw meat diets, and I stick to either a Purina or Royal Canin diet. I think those are the two best diets that we have for reproduction on the market.
One more question just came in. Cindy is wondering, can a dam be bred under 24 months of age?
Can she? Of course she can. And fertility is going to be better at that age. I never breed on the first heat cycle because fertility tends to be really poor on that heat cycle. Sometimes they're just practicing ovulating. They're really not serious about it. So frequently they don't get pregnant on the first heat. But under 24 months of age, I think it's fine as long as your breed doesn't either need health screening or you can do a health screening process that will allow you to know what the hips look like before she's 2. That means a pen hip or a preliminary OFA, because we don't recommend that you breed dogs without their health screening done. Regardless of the breed, almost every dog needs some kind of health screening. Now, DNA tests can be done as soon as they're born because your DNA doesn't change from the time you're a day old till the time that you die. So your DNA testing can be done young, but things like OFA x-rays need to be done after age 2, unless you do either a preliminary under age 2 or a pen hip that can be done as early as 16 weeks of age.
Thank you so much, Dr. Greer. Thank you for everybody for asking questions. And, if you have another question for Dr. Greer, for any of our pet care pros, please, I encourage you to call them. You can do so. There's the number here on your screen. You can call 800-786-4751. Our pet care pros will reach out to Dr. Greer if you have a question for her. And again, if you like what you saw today, you love learning about pet health, I encourage you to sign up for our emails, for our text messages. We send lots of educational, informational videos and articles and lots of webinars with Dr. Greer. So again, I encourage you to find those. And again, find us on YouTube, find us on Facebook, Instagram, and Twitter. Again, thank you everybody for joining us today. And thank you, Dr. Greer. Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.